Well, it's 9 o'clock. Today's Monday, May 27th, 2020. This meeting is now open. First item is to discuss COVID treatments by Dr. Richard Bartlett. Randy, would you want to introduce the doctor?
Yes, I'd be glad to. By way of introduction, I would just say that this COVID virus is so serious and so hard for some. I mean, one of my friends contacted me over the weekend that has it, and he started to take Dr. Bartlett's treatment. He said he felt better, but it's not out of the woods. This is a serious thing. And as our county commissioners court has always been very interested in the health of our employees, I thought it would be a good thing to do is to have all the knowledge we can have about, especially about early treatment. Once they get so sick they have to go to the hospital, our hospital is being under great stress with their own personnel who have COVID and with the ICU filling up. And if we can help keep people out of the hospital, keep them well, then that would be a wonderful thing for our employees. And I want all of our employees and their families to know about all the different options, and then they can weigh their options with their own doctor. And Dr. Bartlett's not trying to become the county doctor. He just has done something that's pretty marvelous, and I wanted our people to hear about it. So with that, Richard, I'll let you begin to speak.
Thank you, Randy. Well, I'm honored to be here speaking with you, and I want to compliment the Midland County Commissioners and Judge on having an infrastructure that has the purpose of meeting the needs of the county employees. And that is forward-thinking, very progressive, and it is a great thing to build on. And so I want to talk about, everybody's heard about the treatment protocol that I have. If you go to covidsilverbullet.com, that's where it outlines a paper that explains the treatment and the science behind it. But I'm getting calls from the UK, from Australia, from El Salvador, from Colombia, and people are employing this and saving their citizens' lives. And everyone's heard at this point of the ICU south of San Antonio that, unbeknownst to me, started using my protocol in their ICU and emptied their ICU in 48 hours. So that's at the end of the disease process, and still it's effective. But there's other hospitals in multiple states now that are already using this in their hospitals. But if you use it in early treatment, which is about your clinic and your employees, this is the winning strategy: early treatment. And that requires early detection. We've heard of false negatives and false positives with the testing. The testing is good when it's accurate, but you need to use symptomatology, is the term that Dr. Abraham coined. He's a US congressman that's also a physician in Louisiana. He's treated hundreds of COVID patients, and 100% have lived, zero mortality. Compare that with what's happening locally. But my protocol is already in the hands in the White House. It's in Congress, being talked about in Congress. This is something that's already being successful. And I'll just give you an example. I woke up the other morning to a phone call, and a fellow says, "Is this Dr. Bartlett?" And I said, "Yes." He says, "You saved my life." I said, "Who is this?" And he says, "I'm James Lloyd. I'm an attorney in California. And I tested positive for COVID. They gave me some antibiotics and an albuterol inhaler. I got sicker. They tried something else. I got sicker. I thought I was going to die Saturday, and I insisted on them giving me your treatment because I'm an attorney. I was able to tell them I really wanted it because it is FDA approved to help people breathe. COVID is a breathing problem, and a breathing treatment makes sense. He said after the first treatment, I could breathe. It's amazing. And so he has put a post on Facebook and given his story, and he is ecstatic that he's alive, if you'll look at what's happening in our city even. But there's hospitals that are using this. Another story is a gentleman that I spoke to last night. Last week, he called and said, "We're in Little Rock, Arkansas, and my wife is short of breath. She has chest pain. My doctors here are friends of mine, and they will not give anything because they said there's no early treatment approved," which is correct. There is no treatment approved. But if you'll look, people are getting treatments in the hospital here. So apparently no treatment is approved, but they're getting treatment. early treatment with my protocol. I don't have a license in Arkansas. I said, if she's stable enough to come across the border to Texas, there are doctors who do telemedicine that are using my protocols. So I followed up last night with him, and he said she's doing great. She's on the mend. Thank you. He's very thankful. I'm telling you, people are coming from other states across the border for help. But we have providers in many states now that are using this protocol successfully. This is not a secret in Midland or Texas. This is not a secret in the United States. I've gotten calls, and it's being used around the world now. It's not a new idea. It's not my solo idea. Doctors are coming to the same conclusion around the world. That's how come in Taiwan, where they're treating their citizens early, they're using early treatment, and they're using inhaled steroids. They've had 7 people die in the last 7 months of this pandemic in a country of 24 million. Compare that to just Midland County. We need to catch up. We need to get on that path of early treatment and using an effective treatment strategy. The US Congressman Abraham said, I was using oral steroids, and then I came across what Dr. Bartlett's doing, and I'm doing both. And actually Dr. Bartlett's works better if someone has diabetes, because if you use oral steroids or IV steroids, like they're using, the University of Oxford proved that corticosteroids improve mortality. There is no other treatment that's offered out there in any hospital, local or far and wide, that improves mortality, how many people die, except corticosteroids. And Oxford showed if you give IV steroids, they improve, less people die. And I'm talking about early treatment with a targeted approach, a respiratory breathing treatment for a breathing problem. When people come to, very often with COVID, people will say, I can't breathe. And it's pathetic that a doctor will not help them breathe. And now worldwide, doctors, not just in the United States, are enacting a winning strategy, and it's available, it's cheap, it's generic, it's FDA approved. It was
I'm doing okay today?
Yes, sir. How about yourself?
Oh, I can't complain. It's Monday.
Right.
Come on right up here in the middle. We have rooms
You
today.
need Mtg.
Okay. I do use the name of the Father, Son, and the Holy Spirit in my ceremony. Is that appropriate for you?
There you go. Sorry, doctor.
That's okay. I believe in God and prayer. So I will say for $3, the cost of $3, a cup of, which is the price of a cup of coffee at Starbucks, you can stay at home on your couch after seeing the provider at the Midland County Clinic, if it's an employee, and they can stay at home on their couch if they test positive for COVID and they have early symptoms, and get relief from their shortness of breath and their chest pain while they're watching Netflix. And so this is a no-brainer. It'll offload the pressure on the hospital. We're talking about pre-hospital care, outside of the hospital care, proactive. The American healthcare system is based on early detection and early treatment of every disease so far. That's been our winning strategy that has put us on the top. That's why the president of Russia flew to the United States for his surgery when he needed heart surgery years ago. That's why world leaders come to the United States, because we're the best at this. Early detection, early treatment of heart disease, stroke, cancer, and every infection has been our strategy until one disease, COVID, in January. So early treatment, your clinic that you have set up for your employees is a godsend. It's a winning strategy. You have done an excellent job of setting the infrastructure for early treatment. It'll not only save money, but it will save lives. It'll improve people's productivity. They'll be able to get back to work sooner. People recover quicker. We tell people take Tylenol just because we want them to get symptom relief, because we want to alleviate human suffering. How about if someone's short of breath and they're having trouble breathing, helping them breathe? If they feel like they're drowning, like James Lloyd said, I felt like I was drowning and now I can breathe. That sounds like something you would want for your employees. And so there's more than one way to treat this. I have a way that's working and saving lives, and I want you to be aware of it. Thank you, Randy, for inviting me. It's been a pleasure to talk to you all and meet you.
Thank you so much. And then I would open up for any of our employees, elected officials, or department heads that are online right now. If you have any questions, now would be a good time to ask them from Dr. Bartlett.
Dr. Bartlett, this is Commissioner Scott Ramsey.
and no disrespect intended on this statement. I don't think this was the proper forum for this. I know you're a wonderful doctor, but the county commissioner's court, I just don't think this was it. But with that said, I do have questions that were posed to me by a constituent. If you wouldn't mind answering a few of these, is that okay?
Sure. And I don't know why it would be inappropriate if you have a clinic for your employees and you're involved in healthcare to some degree. I'm confused on why you would say it's not appropriate to talk about healthcare.
Well, we can get into that at a different time. So let's go to these questions. How many of your patients tested positive, actually took the test that you treated?
Actually, we have multiple clinics that are using this protocol. Just one of them had 200 that have tested positive, 100% survival. That's just one of the many clinics. Next question.
Can you give me, what were the patients' ages?
I think the oldest was 81. I don't know how young the youngest was.
It just is a range of people.
Elderly to young.
Okay. Did any of them have any underlying conditions?
Thank you for that question. One of my first patients has 2 forms of lymphoma that she's still fighting, 2 kinds of blood cancer. And she's a grandmother. For 5 days, she was flat on her back in bed at home with a fever and extreme fatigue that you're hearing comes along with COVID. Could not get out of bed for 5 days. She had heard me on the radio and she found my phone number and called me and said, my granddaughter tested positive. I'm worried I have COVID. She went through the symptoms. I said, I'm sure you do. We started the treatment that night. She had her first good night's sleep in 5 days. She woke up in the morning fever-free. Over the weekend, she recovers. And on Monday, she teaches an 8-hour Skype day of teaching students music, her music lessons. And so that's just an example. She's still getting chemotherapy. She's still fighting 2 forms of lymphoma. She had radiation a month before I treated her. So I'm talking about the sickest of the sick are responding to this. Here's another example. Another grandmother, 5 days, fever, chills, body aches, fatigue. She's convinced she's going to die. She has had her chest cracked for 4-vessel bypass surgery. She's on blood pressure medicine for blood pressure. She's on medicine for thyroid disease. She gets the treatments and she can't believe that she can breathe, that her fever breaks. She's symptom free. We're talking about patients who become symptom free and then have 2 consecutive negatives. When you, that's the definition of a cure from COVID. And so I have story after story of happy endings.
That's wonderful. Next one, how many recovered at home and how many were hospitalized?
The vast majority are able to be treated at home. And that is a benefit even for the community so that the hospital is not overwhelmed, which was a concern that we were told in January. Also, with the situation of actually using this protocol in ICUs and emptying the ICU, it works from that direction as well as far as helping the community. And so very few have needed to be hospitalized temporarily. Some of the patients have, when talking to Dr. Abraham in Louisiana, some patients are actually contracting it in the hospital, unfortunately.
Okay, but did you answer the question about how many of the people that you treated were on respirators?
Wow. That's a good question because I focus on outpatient treatment. And so when the hospital in San Antonio started this protocol without me, they emptied their ICU. They said prior to using this protocol, they were having to intubate 50% of the patients that came in their ICU with COVID and transfer them to San Antonio. And they said, since that happened a month ago, their ICU is still empty. They're using this strategy in their clinic, in their community as a early treatment. And it's keeping people from even having to go to the ICU in the first place in that city. And so you're asking a very good question.
And the last one, it said, it's kind of lengthy. Did you have a control group who didn't receive the treatment to compare to the group that did receive the treatment? In other words, how can we know if the treatment cured the patients or if the disease simply ran its course?
That's an excellent question. So when you have patients who I'm an ER doctor, and actually this strategy came to me while I was working in the emergency room. So until COVID came, if someone had an oxygen saturation on room air below 90, if they were healthy before that, athletic, young, there was no confusion. They were going to be transferred to the hospital and admitted. But with COVID, one of my patients, his oxygen saturation was 86 at home on room air. And his story is on Facebook. I think it's got 130,000 views so far in Odessa, and he's totally recovered. And so we're having people who are deathly sick. I'm not a scientist. I'm not doing research on lab rats. And what's happening in Taiwan, where 7 people have died, is they're treating people and doing studies parallel to that. There are scientists doing the research parallel, but they're treating the patients with inhaled steroids. They're doing that in Japan, where they got 121 million citizens and less than 1,000 have died during this whole pandemic. They're doing that in South Korea, where they got 50 million citizens and less than 300 have died during this whole pandemic. Compare that to what's happening in Texas and in Midland County. And so there's a place for a doctor to treat his patients when they come in short of breath and they can't breathe. It's important for airway breathing circulation. We have a FDA approved medication that can be given in a strategic way that is immediately helping people that have COVID. And there's a place for scientists to do the research on the meantime that takes 6 months. Our loved ones and our citizens that are sick right now cannot wait 6 months. If they're sick right now with COVID, they cannot wait for someone to finish a study. Often, if they have the end result of a study, they'll stop it immediately, whether it's a good outcome or a bad outcome, and they'll make it public because that's the ethical thing to do. But we have studies in the UK, in Oxford, the NIH is doing a study that'll be done in October. France is doing a study. They haven't announced their findings yet. Spain says they're going to do a study. And Queensland University in Australia has announced they're going to study inhaled budesonide as a solution for COVID, a treatment for COVID. That's the exact treatment that I'm doing. And so that's 5 reputable organizations bigger than me, with more financing than me and more time than I have, that are studying this same treatment protocol of inhaled budesonide for COVID. And there's a reason why they've stumbled upon this. A little caveat, COVID can get in the eyes, in the conjunctiva. And so France studied budesonide in eye drops, and they found it effective. And so this is not a mystery. The whole world is now aware inhaled budesonide has great potential and is actually helpful, and they're studying it in 5 major institutions minus me. I'm not Oxford University. I'm a doctor treating my patients.
Well, Dr. Bartlett, I want to thank you for answering these questions, candidly and forthright. I really appreciate what you've just done. Thanks again.
Thank you, sir. Does anyone else have a question?
Anybody else? Dr. Bartlett, I'd like to.
Hey, Terry, I have one question.
Go ahead.
Dr. Bartlett, you mentioned that our clinic would know how to do this, Midland County Clinic. Are you aware of our particular providers, and do you know if they have actually aware of your treatment?
Randy, it's not a secret. I put it on covidsilverbullet.com. If they click on the case study, that's the 16-page white paper that I wrote that's actually at the publisher right now, and for a journal. And the last paragraph has the treatment protocol. And so COVID is not asthma. Budesonide has been used since 73 when it was patented as a treatment for asthma, but it's an anti-inflammatory breathing medicine. And COVID is a inflammatory, although asthma is an inflammatory disease, COVID is an inflammatory disease times 1,000. That's why this strategy works. The dosage is increased over asthma, and that's in the protocol. It's in the last paragraph. And so we've got 51 articles from reputable journals, medical journals, that are cited and are references at the bottom of the paper so people can look that up. We've answered every question. Here's something that needs to be understood. There are hospitals using this in Texas and California. and other states now are looking at it. And every hospital has an isolation room with negative pressure. And that is because if we have Ebola or we have another disaster that comes in, we can put them in that room and it won't spread to other patients. And it won't. And we have a cart in front of that room. Everybody puts on universal precautions, and so the healthcare workers are safe. And so they can give these nebulizer breathing treatments in any hospital safely.
Thank you very much.
Thank you.
Okay, sorry about that. It kicked me off, so I had to try to get back on. Hope I'm back on now. Thank you, Dr. Bartlett. Was that it? Because I just did come back on.
Yeah.
Okay.
Oh, let me show you. Here's budesonide. Yeah, I don't know if you can see that. This is $3 a treatment. That's pretty cheap compared to, and it's at home. And people get relief for $3 from something that can kill you. I think it's not a bad idea.